And unfortunately, we see a fair bit of injuries in our patients who are deemed as weekend warriors. They do insufficient warm-up during the exercises and can load their spine abnormally when they do their exercises. Hi, I'm Dr. Loo Wee Lim. I'm an orthopedic surgeon by training. My subspecialty is in spine surgery. I see a variety of orthopedic conditions like hip and knee pain as well as shoulder pain, but my main interest is in spine surgery. I have focusing on neck surgery and lower spine surgery. So most of the spinal conditions that I see on a daily basis include things like back sprain, as well as slip disc and degenerative conditions like cervical myelopathy and lumbar stenosis. A lot of these conditions arises as a result of an abnormal loading of the disc due to insubsequent warm-up during exercises or carrying abnormally heavy loads. Most of the degenerative conditions that occur as a result of aging, and in our local context, it happens in the neck as well as the lower back. So most of the spinal conditions do not require surgery. They tend to improve with time, as well as rest, analgesia, and physiotherapy. In the event that the patients require surgery, a variety of surgery can be performed depending on the pathology. Most of the time, it will include some minimally invasive decompression of the area of interest. So most of the time, we intervene before the condition becomes serious, but in some cases, the condition can deteriorate rather fast. Most likely, a slip disc can press on the nerve, resulting in profound weakness, numbness, and the ability to control passing urine and passing motion. That's where the condition is deemed serious enough to warrant urgent surgery, and usually surgery needs to be undertaken in 48 hours. If not, the nerve damage could be permanent. Slip disc can occur in a variety of ways. It can occur after a very violent cough, for example, or chronic straining during stools, abnormal loading of the spine during gym exercises. A lot of patients tend to wait and suffer in silence while we're hoping that the slip disc will go away. Unfortunately, while there are some cases where the slip disc becomes smaller with time, the majority of patients experience worsening of the neurological status and they have persistent numbness even after waiting for a period of 6 weeks. The reason is because there is ongoing nerve damage by the slip disc. So most of the time, the best results of the surgery is done when the symptoms are less than 4 weeks or so. Surgery is very safe for a slip disc because we have developed a lot of techniques for our surgery, and the slip disc usually can be removed in under 1 hour or so. Most of the patients will be able to go home after 2 days, and the cases where the patient is elderly and has a major pathology like spinal stenosis, the recovery can take place over 1 to 2 weeks. Unfortunately, if the patient is extremely debilitated by the condition, they may need to stay longer. A lot of the time, prevention includes things like core strengthening, as well as adopting very good posture during daily activities, like maintaining the laptop monitor, adjusting your sitting chair as well as your driving seat, and also employ a personal trainer when you do gym training exercises. And unfortunately, we see a fair bit of injuries in our patients who are deemed as weekend warriors. They do insufficient warm-up during the exercises and can load their spine abnormally when they do their exercises. I think one of the key thing to take note is that a low weight has definitely been shown to improve spinal health. As you know, as a low BMI and a healthy BMI has been shown to have better outcomes in spinal surgeries. It also helps that if one is lose 5 to 10 kilograms of his body weight, he will experience less back pain.